have with me the Director General of the Nigerian Center for Disease Control, Chikwe Ihekweazu, as he joins me now to discuss these developments. Thank you so much for your time, sir. And I'd first like to get your thoughts on this news coming out from the UK.
So thank you very much. Here at the Nigeria Center for Disease Control, one of our key roles is to keep track of new science coming out across the world. And for COVID, unlike any other disease in recent times, this really literally comes out on a daily basis as scientists across the world are working extremely hard to find new therapeutics, new diagnostics, and new vaccines for this new disease. So yesterday we got some news out of the UK. It's in an Oxford group, a group I know fairly well actually, released a press statement on some new data and new research they've done on dexamethasone, showing a significant impact on morbidity and mortality among the severely ill. However, like we said on our Twitter handle, we have to wait for a bit more. They haven't released the actual data behind the work they've done. This is because of the pressure generally to demonstrate success that's happened. So they've done a press release with the headline figures. We're now waiting for the data behind the statement they made. And therefore, we will then we'll look at that and inform our own decision. But one thing is for sure, this is a credible group. We have no reason to doubt them. And so we look forward to the details of their research and in order to use that to influence the way we're managing cases in Nigeria.
We're working very aggressively to increase the testing in Nigeria. This is one of the weakest parts of our response. We started from a very low base initially, but we worked extremely hard to move from 5 to 35 labs right now with the ability to test for COVID-19. We had the highest number of tests over the last few days, and we'll keep increasing this progressively across the country. Testing is such an important entry point into the response because of the number of asymptomatic infections and mildly symptomatic infections that we have. So we have to really ramp up our testing because it's an eye into the outbreak. We can't manage something we can't measure sufficiently. So we're working very hard, but we also have our eyes on the future because we never want to be in the situation that we are right now. And the African Center for Disease Control has been a great support for this. So we set a target for ourselves, a very ambitious target about a month ago, to test 2 million people in 3 months. We're not yet meeting that target, but we're well on our way to do so as we introduce new testing opportunities. We're using the Gene Expert platform, the Abbott platform that we use for HIV into the testing apparatus in Nigeria. So we're working extremely, extremely hard across Nigeria to increase the testing rate right now in Nigeria.
I can imagine how arduous the task ahead of you is, because looking at how it is and how complicated it is to move logistics around Nigeria, I can imagine the work that you're doing. But I would also like you to speak on this issue that's also dragging back the work you're doing. I understand that the doctors' strike happening in Nigeria now. I'd like to know what your thoughts on this is, and how we can get this ahead so that we can improve the health outcomes that we want in Nigeria.
Yes, it's really unfortunate that we are facing the possibility of a strike in Nigeria. I know the Honorable Minister of Health, the Honorable Minister of Labor, and all the leadership in the National Assembly, especially the House of Representatives, are working extremely hard to reach a compromise with the doctors. This is an unprecedented time in our history, and the country really needs all of us to come together. Doctors, nurses, pharmacists, medical laboratory scientists, the country needs us now more than ever. At the NCDC, we worked very hard to make sure doctors have the training, the personal protective equipment, and literally everything they need to be able to work safely. It's not easy to get this across the country in real time, and we've had to work extra hard to make sure that they have the personal protective equipment to protect themselves. There may be nooks and crannies around the country where we haven't been able to reach, but we've tried extremely hard to reach every doctor so that they can practice safely. So, I will continue to appeal to all doctors across the country to be patient with government. The country needs us right now. The doctors need us themselves. Everyone needs to work together because none of us is protected or immune from this disease. It can affect any one of us, our mothers, fathers, parents, children. So we just have to get over this outbreak, and then we will slowly address the issues that are being raised. But for the immediate, the provision of personal protective equipment, the training, infection prevention and control practices, we've been supporting every hospital, every public sector, secondary and tertiary hospital in Nigeria to make sure they have what they need to practice medicine safely.